Hello everyone, I am Ghassan Hamoud, an interventional endoscopist and the interim division director for the Gastroenterology and Hepatology program. I would like to welcome you to the Division of Gastroenterology and Hepatology at the University of Missouri School of Medicine in Columbia, Missouri.
We offer very comprehensive gastroenterology training in general gastroenterology with exposure to hepatobiliary and advanced endoscopy and hepatology.
The program is very clinically strong, meaning we build strong clinical gastroenterologists, not only from an endoscopic procedural standpoint, but from a clinical knowledge base and outpatient standpoint.
You get to put a scope in your hand from day one and you will be scoping a ton and you will see a lot of interesting cases.
I've already done a ton of procedures for a first year, which is incredible. You have a lot of autonomy, which is nice, but there's always somebody there to help. I intubated my first TI today, terminal ileum, which is a big landmark for anyone doing GI. And it's only my second week of scoping, so I had a lot of help. It wasn't because I'm good at it, it's because somebody was there telling me exactly what to do, cheering me on. It's a great learning environment.
We have a culture of safety and openness. This is very much a fellow-driven program. As program director, I see myself part as a program manager, and part of that also as a program mom. I really want our fellows, each one of them, to succeed both personally and professionally.
The GI Fellowship Training Program is a family-oriented program. All fellows as well as faculty are considered part of the whole team. We collaborate with each other. We work closely with our trainees to continue to promote and improve the dynamics of the GI Fellowship Program.
We are exposed to a wide variety of clinical gastroenterological pathologies, and we get to do endoscopic procedures associated with those pathologies, so we really get a wide range of education and time to grow our endoscopic skills.
It's a really fantastic specialty because it really combines a lot of clinical skills versus just procedural skills. So you get to be both a clinician and a proceduralist, which I think is so neat. So you see the patient in clinic, you hear what they're complaining about, and then you go in and take a look for yourself. And often you can find the problem, which is pretty amazing, and fix it.
You build your numbers, your efficiency and your proficiency with your endoscopic procedures very quickly. I'm at the early portion of my third year, and I've done over 700 colonoscopies and close to 500 upper endoscopies. So, well beyond our graduation requirements from the ACGME.
I'm a new fellow, kind of 2 weeks into procedures, and I've already done primary proceduralist on, I think, 7 colonoscopies and then also 8 EGDs.
We have a very large referral basis. We have patients who drive several hours just to come to the area because we have been known for quality and service.
One of the fortunate things that we have is a great leadership, that they are committed into promotion of healthcare to Missourians and to every patient. At Mizzou, we collaborate with all subspecialties. We provide a cutting-edge, innovative endoscopy as well as in research.
We've been serving a lot of veterans. We also see a lot of complex cases that are referred out to us from all over Missouri and even surrounding states.
Well, last year we kind of optimized using the use of conscious sedation in screening procedures and diagnostic procedures in our university setting. And this year we're actually trying to improve the quality assessment of when to do appropriate colorectal cancer screening in the outpatient setting, primarily in the VA.
We see ourselves as mentors and also as a safety net. Fellows have a lot of discrepancy to reason with us. Why do they want to do A versus B? And together, we formulate a plan. They have a lot of autonomy. Of course, we're always there for them. We are always available, and we do supervise them for all procedures.
The faculty and the fellows, we meet on a regular basis, almost on weekly, even monthly basis. We interacted during our conferences. We meet at the division meeting. We listen to each other's in terms of concerns, things to improve the fellowships. This interaction has been really very close, especially with our trainees, and that brought us into improving the fellowship program as well as issues that are related to clinical operations.
Our faculty have been very careful to make us know that we see you as physicians because you are internal medicine doctors. We're just helping you take it to the next step. And you kind of buddy up with a fellow and they really show you all the tricks of the trade and exactly what to do. They're so patient. I've asked so many questions and never once did I feel like it was a stupid question, which was, that says a lot, being a new person.
This interaction, everybody brings into the table their expertise, their skills, and that makes us a good teamwork.
It's a family, so I think, the fellows, we are all in this together and we cover each other when emergencies may come up or schedule changes are needed.
Our trainees are happy. They have a lot of say into the direction of the program. We are very flexible and adaptable and open to new ideas. We might be training our trainees, but we learn so much from them as well.
It's nice that we have grand rounds weekly. In addition to that, we have typically 1 or 2 conferences a week, and we also have a monthly multidisciplinary conference where we have other services available like surgery, pathology, radiology. In addition to that, we have I think it's every other month we do pathology conferences with the pathology residents too.
Our conferences are set up to adjust to our schedule. We typically will have didactics 1 day a week in the morning, as well as a didactic or a division meeting one evening around 5 p.m. once a week.
For GI, we have such a multitude of didactic conferences. And we also have invited speakers who come in periodically to give us grand rounds, and these are nationally known gastroenterologists. Our fellows are also supported to attend national conferences, so they go to our biggest GI meetings. Usually they get to choose which meeting depending, on their area of interest. And we support them both financially and, of course, having the time to do so. We have faculty who have interest in very different areas of GI, from hepatobiliary topics to IBD to basic and translational research. So, we have a wide continuum of faculty with wide, varied interests, and, we are very dedicated to our fellows' education and training. We guide them to build their CVs and their careers.
We are all involved in research projects from both the quality improvement as well as a capstone research project. There's ample opportunity and ample direction from our faculty staff to guide us down whatever academic interests we may have.
We do have a hepatology program, so if you want to learn more about the liver, you're able to do that.
We're actually adding an advanced endoscopy fellowship, and a lot of our fellows who have gone on to do advanced endoscopy in the past have had a lot of head start in terms of other fellows because we get such a high number of volume that they are very comfortable when they actually get into doing those type of advanced procedures.
Our program is currently consists of 16 faculty and 11 GI fellows in addition to 1 hepatology fellow. We are innovative, compassionate, and promote diversity and inclusion.
In our program, we want someone who is, first of all, an excellent clinician. It doesn't matter what specialty you practice, patient care is at heart of what we do.
Really caring about patients, really listening to what they have to say, and just remember that you're a clinician too. You're not just a robot going through with all the scoping procedures. This is a person that you're taking care of.
A strong fellow that brings value to our division, a fellow who is willing to work with our group, a fellow who is dedicated and has passion towards GI and liver disease, a fellow with scholarly activities.
We want clinicians who are caring and compassionate, who are hardworking and team players. We want qualities such as empathy and altruism in our candidates.
It's just a really wonderful size and balance between all of the energy and excitement and forward thought of an academic medical center with a place that's easy to live.
By having the university here, it brings in enormous amounts of diversity and other opportunities to explore things that you might find only in a bigger city.
I do love this town. It has a charm to it. I feel like people they smile, when you meet them. And I've been to many big cities and you don't have that, that friendliness.
There's a huge network of trails for walking, running, biking. There's local breweries and a vineyard. There's some distilleries around.
I can go canoeing, kayaking, bike riding, right from my house.
We have 4 kids and our public education system is top-notch.
Much of Columbia is focused on education and healthcare. Because of that, we draw more culture to Columbia and have more of a cosmopolitan feel than other towns our size.
You're going to have most of the big city amenities, theater, ball, we have Division I in athletics, of course, the Missouri Tigers, members of the SEC conference.
We're looking for people who are curious, who are flexible, who don't expect everything to be the way it is today and want to be part of that change. People who demonstrate curiosity, flexibility, and also just a deep and unfailing commitment to their patients.